practicing public health officers and technicians in this country. So there's a solidarity song we say, Solidarity Forever. So you allow us to sing it by holding our hands. And to go in the day. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. Viva, viva health workers, viva. Thank you. Now, my name is Brown Ashira. We salute you, members of the Fourth Estate. My name is Brown Ashira. Once again, I'm the National Secretary General and the CEO for Kenya Environmental Health and Public Health Practitioners Union. That is abbreviated as Kehphpu. A union bringing together all the registered and the practicing public health officers and technicians in Kenya. And we were here today to read a statement regarding the establishment of Kenya National Public Health Institute, an institute that has been established in this country. And therefore I'll read the statement as follows. We, the Kenya Environmental Health and Public Health Practitioners Union, together with the Kenya National Union of Medical Laboratory Officers, Knumlo, all of them being public sector unions, representing public health officers, specialists and technicians, as well as laboratory officers in this country, will wish to address the Minister of Health, the Head of Public Service, and the Public Service Commission in this country regarding an professional and procedural rush or hurry in the creation, formation, and operationalization of the Kenya National Public Health Institute. Without, of course, stakeholder engagement and in total disregard of Article 118 and Article 196 of the Constitution of Kenya 2010, as well as Article 10, subsection 2, on the national values and the principles of governance in the policy-making process, as well as the laid down human resource manuals and policies, the Employment Act, the Public Service Commission Act, and the Labor Relations Act. The Minister of Health gave out a directive dated 22nd. When I say a directive, I mean the directive from the CS, Honorable Duale, dated 22nd of April 2025, reference number MOH/CS/Volume 2/76, addressed to both the principal secretaries, and that is for the State Department of Medical Services and the State Department of Public Health and Professional Standards, directing the transitioning of select public health and laboratory functions to Knphi without a proper and clear legal framework, human resource instruments, validation, and in complete disregard of the security of tenure of our members' benefits, let alone job security. We believe establishment of any government policy or any saga for that matter, because we believe Knphi is a saga, that is semi-autonomous government agency, must involve all the implementing stakeholders as a requirement of the law, and must also look at the future with the present in mind. All the health policies must be both retrospective and prospective in nature. We have acquired the following. The hurried formation of Knphi, the hurried creation and formation of Kenya National Public Health Institute without the involvement of critical implementing players. When I say implementing players, if you look at the function of the Kenya National Public Health Institute, over 90% are purely for public health and lab. Actually, less than 5% you're equal and curative kidogo. Namely, public health union and laboratory union. And establishing the leadership and governance of the institute without key implementing cadres and bias towards clinical cadres in complete disregard of the mandate of the institute. We also queried the operationalization of the institute, including its legal framework, the human resource aspect, rather the component of the human resource, the security of our members' benefits, and the silence of the Public Service Commission in this whole regard. I want to request my SG for the lab union to read for us the demands, then we'll maybe can come back later. Welcome, Kehphpu.
Good afternoon, members of the press.
Good afternoon.
My name is Pius Nyakundi. I'm the National Secretary General and the Chief Executive Officer of the Kenya National Union of Medical Medical Officers. So I'll be here to read the demands that have been made or formulated by the Public Health Union and the Kenya National Union of Medical Medical Officers. So our demand number one is that the institute must be led by a mix of implementing cadres, namely the public health officers and the medical laboratory officers. The DG must be either be a public health officer or a medical laboratory officer with extensive knowledge and skills in respective fields and having been registered by relevant bodies. The board members must also be a mix of implementing cadres, that is the medical laboratory officers and the public health officers, and not as it is currently formulated. On service delivery, we demand that the institute must develop a clear human resource instrument and invite stakeholders for validation before operationalization of the institute. On human resource management, we demand that the institute need to advertise for its own officers and equally have a budget to run its operations from Parliament. We oppose to the transition of staffs and public health assets to the institute. All critical divisions must be led by relevant cadre-specific professions. Until when, we strongly oppose the directive by the CS to hurriedly and blindly transition our members to the Knphi without proper legal framework. We contend that this is a sole task and mandate of Public Service Commission, which must be done following an engagement with various stakeholders, Public Health Union, and the Kenya National Union of Medical Laboratory Officers, notwithstanding. If our above demands will not be met in 7 days, effective today, we are going to disrupt our services by calling out our members from the public health sector, that is the public health officers and the Kenya National Union of Medical Laboratory members, that is all the medical laboratory professionals practicing in Kenya, and seek a legal action. However, we call upon the government to give us a hear so that we can be able to have a deliberation over the same. We are available for any discussion that can be able to solve this issue amicably. Thank you.
Thank you. We can have our chair.
Yes, good afternoon, members of the Congress. I'm Odipo Nicholas, the National Chairperson or Chairman, Kenya National Union of Medical Laboratory Officers. Indeed, today is a very sad day for this country. It's not only for the health sector, but entire health of citizens of this country is at stake. We want to make it very clear. We are not opposing the formation of Kenya Institute of Kenya
National Public Health Institute.
Knphi. Yes. We are not opposing it. But the manner in which it is being hurriedly formed raises a lot of eyebrows. Number one, we have a crisis at the Ministry of Health brought about by misadvice by the person who is responsible to advise the government on issues to do with health. That is the Director General of Health, Mr. Patrick Amo. If you look at the labs are not basically handling disease surveillance. The labs at the national level are also reference labs that all the specialized tests from the counties goes to those labs to be done. We are very much aware of the economic situation of this country and the disease burden. These things cannot be done if we don't have a lab that coordinates all the HIV specialized tests, all the TB specialized tests, malaria EQA, and this must only be done at the national level, the national level. We are also saying that transferring all the lab departments to an institute is going to kill the practice of medical laboratory in this country, because as we are all aware, health is devolved. But the policy formulation remains with the Ministry of Health at Afya House. These policies cannot be made by a parastatal in the name of Kenya National Public Health Institute. Why is it that the Director General of Health cannot come out very clearly and advise the government which labs are supposed to go into Knphi and which labs are supposed to remain at the mainstream ministry for policy formulation and helping the citizens of this country in these tests that require that are expensive for them? Number 3, I want to address Honorable Duale, the Cabinet Secretary for Health. Waziri, when we first met at your offices, you told us that the first issues that you are going to deal with is dealing with issues of quacks. I want to inform you that in the Division of National Labs, the person spearheading the transition of labs into Knphi is not a medical laboratory personnel. This person is acting in express instruction from the Director General of Health and the Director General of Knphi. We are all aware that for you to practice in any profession, you must be licensed and registered to practice. How then is somebody handling such critical departments by not being licensed? What of the ethics of practice? Who is he going to be answerable to in case there's a professional disciplinary issue that is coming upon him? We are requesting you, Waziri, please listen to us. You've been misled, you've been misadvised. Let us have a tripartite negotiations and see how best this Knphi can be nurtured by all the healthcare in the Republic of Kenya. Thank you.
Comrades, power. Kabla nilete mwenzangu Treasurer aseme jambo, ni jambo la kuhuzunisha sana. Maanake wakati tukutana na Waziri Duale, unajua tunamuita bulldozer. Ni bulldozer sababu alikuja pale kwa ministry, kuna cartels wengi sana kwa ministry ya Wizara ya Afya pale. Na tukaelewana ya kwamba ataweza kila kada itafanya kazi yake. Lakini ikifika mahali ya kwamba unapata kama institute kama Kenya National Public Health Institute, that's a pure, I invite you mwende msoma hiyo the legal notice. If you look at the divisions ambazo zimewekwa pale, they are purely public health divisions. Alafu unachukua Director General ambaye ni daktari, hatuna shida na madaktari, ni madugu zetu. Lakini nafaa ieleweke ya kwamba orientation ya daktari na public health officer ama NAB ni tofauti. Mimi vile nitakuangalia kwa macho ya daktari kuona kama wewe ni mgonjwa. Mimi sitakuona kama wewe ni mgonjwa. Kazi yangu kama public health officer ni kupigana na ugonjwa. Ndio unaona kama hapa kuna cholera inaendelea Nairobi saa hii. Watu wanakula mavi, watu wanakula chemicals. Ni kwa sababu watu wanakufa hapa, hiyo sababu tumetelekeza katika hali ya kuweza kuimprove the preventive interventions in this country. The public health activities saa hii zimepigwa teke. Funding ya public health in this country imekuwa shida. Tumekuwa na madugu zetu madaktari. Unajua ni madugu ile tulisema hiyo afya usio referral hospital. Kila mtu afanye kazi kulingana na ile kitu amesomea. Na hizi kazi ambazo tumekuwa listed kwa National Public Health Institute, ukizisoma vizuri, tuko na license. Mimi niko na license by Public Health Officers and Technicians Council. Niko na license yangu hivi ambayo inanipea jukumu ya kufanya hiyo kazi. Wewe sio PHO, wewe sio mtu ya lab. Alafu unakaa pale, we want to coordinate preventive and public health activities. We are saying shame on you. We are going to come on, and by the way, it's not a threat. Tunaambia waziri ulisema ya kwamba ukikutana pale kila kada itafanya kazi yake. Hatuwezi kubali ya kwamba sisi ambao ni PHO, sisi ambao ni lab, tunapata kwamba kada moja inakuja na kutukalia. Hiyo kitu walianza wakati wasema mambo ya merging ya regulatory bodies. Tukakataa. Sasa wamekuja, they now want to fizzle our functions. By the way, for your information, ukiona tukiwa hapa tunawakilisha members na tunawakilisha pia functions. Ukiona function ya your card inaenda, unakuwa na wasiwasi. Maana tumekula kiapo kulinda hizo functions na tumekula kiapo kulinda our members. Kwa hivyo tunasema tukatai Knphi. There is something that's ambayo wakati yake imefika. Tunajua hata wakati ilianza CDC tumeanzia Ethiopia wameweka kila mahali kumeweka, lakini tunasema governance yake na leadership yake lazima iweze watu wanasimamia, including the board of directors. Ukiangalia board of directors utashangaa wengi wao unapata ni madaktari. Yani sasa hebu nikuulize kama watu kama cholera mfano kama iko sahihi. Does a doctor knows how to do for example mambo ya preventive? Haelewi. Lazima tuheshimu public health interventions na lazima tuheshimu zile kada ambazo zinahusika katika masuala ya kufanya mambo ya preventive katika hii Kenya. Na prevention haijaanzia hapa Kenya. Imeanza from Malta in the 1978. Na tunasema hivi bwana CS. Sisi watu wetu wale ambao wanafanya kazi kwa port health. Unajua sisi kuna watu wanafanya kazi kwa port health. They are called port health officers. Wanafanya screening ya magonjwa. Unatuambia tuwatolee port health waende kwa NPHI hapa Kenyatta. Who is going to do port health activities at the points of entry? Nani atafanya huko? Who is going to do screening of travelers? Nani atafanya screening of other things? Unatuambia for example watoka kwa disease surveillance unit. Who is going to do that? Alafu anasema tena ati wa transition na assets. Knphi is not a new saga. Kuna Kenyatta National Hospital ambayo imekuweko, tuko na MTRH, kuna KTRH. Wanafaa kutangaza ajira za wafanyikazi wao. We are not going to allow watu wetu officers wetu wote PHO za lab watolewe wote. Ati wanakuwa transition fully from this one to this one. Hii watu tutakubali. Na tunasema after 7 days we'll be back. By the way, let me tell you, it's not a threat. Waziri, if you cannot be able to listen to us, we'll show you the way you can be able to listen to you. Because hii Kenya tumezoea watu wanagandamizwa na kada zinagandamizwa, wengine wanakalia wakalia wengine. Kwa hivyo we are against that transition, na tunaambia you know sagas in this country. Wacha niseme hivi, sagas zinasimamiwa na kuna mtu ana chairman ya sagas. Tunamjua, anaitwa Bwana Indimuli. Bwana Indimuli do the honorable thing. Tunajua hata mahali ofisi yako iko. We need to make sure that HR instruments are developed. Hawezi kuchukua tu mtu, wewe sio public service commission, atunaambia mtu amekuwa akifanya kazi 25 years. Alafu anamwambia atiwacha hii kuja pale. Na hiyo kitu kienda ikaisha. Tumeona vitu zikianguka Kenya hii. Kazi hiyo mtu na ni mzee ataenda wapi? So we are saying if they must be able to employ, they need them to have a budget from parliament because it's supposed to be funded by parliament, na waajiri watu yao na waachane na PHOs. Kama we are not going to transition, we are not going to give them everything. Waajiri watu kulingana na tajriba na zile qualifications ambazo kila regulatory body inaitisha. Kwa hivyo let me invite my treasurer who is going to say a few words, then we are going to invite questions. Wacha treasurer wangu ongea kidogo, then we are going to invite questions, then the chairman will come in. Karibu.
Yes, good afternoon, members of the Fourth Estate. My name is Mohamed Ali. I'm the National Treasurer for Public Health Union. And basically, I just want to urge one thing. We are not in oppose of the institute at all. We are not in oppose of the institute. What we want is the structures to be in place. And those structures, especially the human resource aspect of it, we have exactly, interestingly, we have huge shortage at the Ministry of Health. These are ample time, even for the saga under Kenya National Public Health Institute to do and advertise, employ. These are ample time to utilize that. Even allocation of the funds. This is the ample time. Yeah. So we are not opposing anything. We are in support of it. But at the end of the day, we want it to follow the due procedure. That's all I can say. Thank you.
Thank you. Sure.
Now, on the same note, the issues of about quacks. Yesterday, we have a very ugly scene at the airport when there was the issue of a biological risk agent that was in the airport. The same quack we are talking about went to the airport purport that he is a medical laboratory officer. It is pathetic. Sisi tunauliza ministry, tafadhali, kila mtu wakuwe equal. There's no monkey who is better than the other monkey. We are all equal. And the Constitution of the Republic of Kenya protects every citizen from discrimination. We have been discriminated, and it is time we ask, and we humbly ask those people at Knphi House, please, let us talk and see how we can help this country progress in terms of healthcare. Asante.